Hi, my name is Daphne Siwa, and today I will be conducting a head-to-toe assessment. First, I will begin by doing a 360 of the entire room. Now I will perform hand hygiene. And I'm going to clean my stethoscope with an alcohol wipe. Hi, my name is Daphne Siwa. I will be your nurse today. Is it okay if I can perform a head-to-toe assessment on you?
Yep.
Okay, great. I'm just going to provide privacy. And I'm just going to begin with a general survey. So I see that your skin color is appropriate for ethnicity. Your sexual development is appropriate for age and gender. I don't see any obvious physical deformities. Your body parts are symmetrical bilaterally. Your position is sitting upright, comfortable in the bed. Your facial expressions is smiling and maintains good eye contact. Your mood and effect seems calm and comfortable. How are you feeling today?
I'm feeling good.
So her mood and effect is coherent with her facial expressions. Her dress seems appropriate for climate, clean and fitted to the body. Her mobility I'm going to test, so can you please walk towards my finger and then walk backwards. So her gait seems normal as the shoulder width is equal to the base width. Her balance was good as she was walking, and as she was walking I could tell that her range of motion was active in her extremities. And now I'm going to begin by inspecting and palpating the head. So I'm going to begin at the scalp. The scalp is white. There are no lumps, bumps, lesions, or bruises. It seems very clean. Do you feel any pain or tenderness as I palpate?
No.
Okay, her hair distribution is even and her hair color is brown. Now I'm going to look at your facial structures. Your facial structures are symmetrical bilaterally. There are no lumps, bumps, lesions, or bruises, no masses or no deformities. I'm going to palpate for any pain or tenderness. Do you feel any?
No.
Okay. And now I'm going to test the facial nerve, which is cranial nerve number 7. Can you please smile for me? Frown. Close your eyes tightly. Puff your cheeks. Okay, so facial nerve is active and everything is symmetrical. Now I'm going to go towards the eyes. So her lashes are evenly distributed. Her eyes and her eyelids are clean and are of appropriate color. Her sclera is white and her conjunctiva has no discharge or crusting. I'm going to assess the oculomotor nerve using Perla. So her pupils are both equal. They are both size 4. They are round, and we'll see if we're reactive to light. So yes, they both constrict to about a size 3 in light. And for accommodation, can you please follow the pen with your eyes? Okay, so accommodation is good. Now I'm going to assess the ears and inspect. So her ears are of good shape. There are no lumps, bumps, lesions, or bruises. It is of appropriate color and no masses or deformities. Cerumen is present, as I can see. I'm going to palpate the auricle and the tragus. And can you tell me if you feel any pain or tenderness?
No.
Okay, now we'll perform the whisper test. I need you to hold down the tragus on one of your ears, and I will whisper 3 words in the opposite ears, and you have to repeat it back for me.
Okay. 1, 2, 3, 4, 5, 6.
So the patient could hear each 3 words bilaterally in each ear, so that is good. I'm going to move on to your nose. Your nose is midline, symmetrical. There are no deformities. The color is appropriate. No lesions. I'm going to palpate. Do you feel any pain or tenderness?
No.
Okay. I'm going to palpate the frontal and maxillary sinuses. There's no apparent edema. Do you feel any pain or tenderness as I do this?
No.
Okay, great. Now I'm going to test the patency of the nostrils. Can you hold one of your nostrils down and inhale and exhale through the other one? Okay, great. And then the other one. Good, so patency is good in both nostrils. Now I'm going to inspect the mouth and pharynx. So her lips are pink, they're moisturized, hydrated. Can you open up your mouth, please? So her gums, there are no swelling, no bleeding. There are no lesions, they're pink. Her teeth, there are no dental caries, there are 32 teeth present. Her tongue is midline, symmetrical, hydrated, and pink. Her soft palate and her hard palate are intact and pink. I'm going to test the glossopharyngeal nerve and the vagus nerve. Can you please say ah? So the soft palate rises as the patient says ah, and the uvula, as I can see, is midline. I'm going to test the hypoglossal nerve. Can you please repeat the words light, tight, and dynamite?
Light, tight, and dynamite.
So she can say those 3 words without any tremors. Now I'm going to move on to the neck. So her neck, I can see, is an appropriate color. There's no hyperpigmentation, no discoloration. There's no lesions, no scarring, no bruising. I'm going to check the temperature. So the temperature seems warm. Moisture is good, is normal. Texture is smooth. Turgor is good. Non-tempting. Do you feel any pain or tenderness?
No.
Okay, so now I'm going to palpate the carotid arteries bilaterally. I will start here. And the other one. So the strength of the pulses is about 2 plus. They are equal bilaterally, and the rate and rhythm is regular. I'm going to move on to the posterior thorax. Can you please get up and turn around? So for the posterior thorax, I will inspect, and I see that hair distribution is even. There's no scarring, the color is appropriate. There's no lumps, bumps, lesions, or bruises. I'm going to palpate. Do you feel any pain or tenderness?
No.
Okay, texture is smooth. Turgor is good, non-tempting. Temperature is warm. So that's good. And now I am going to check for symmetrical expansion, chest expansion. I'm going to put my hands here, and can you please take a deep breath in and out? So symmetrical chest expansion is good. I'm now going to auscultate and listen for her breathing sounds. Every time I move my stethoscope, can you please take a deep breath in and out?
Yeah.
Okay. Okay, so from what I heard, her breathing sounds were normal. I didn't hear any crackles or wheezing or any adventition sounds. Everything was clear, and now I'm going to inspect and palpate the anterior thorax. So the anterior thorax is, there are no lumps, bumps, lesions, or bruises. I don't see any lacerations, nothing like that. I'm going to palpate the anterior chest. So do you feel any pain or tenderness as I do this?
No.
Okay, texture is smooth, turgor is good, non-tempting, moisture is normal. Okay, and then now I'm going to listen. I'll auscultate the anterior chest. So as I move my stethoscope, can you take a deep breath in and out, please? So her breathing sounds were normal. I didn't hear any crackles or wheezing. Her rate and rhythm was regular. Everything was good on that part. And now I'm going to listen to her heart sounds. I will locate all the valves. So her aortic valve is located at the right sternal border, second intercostal space. Her pulmonic valve is located at the left sternal border, second intercostal space, and this is where S2 is louder at the base. Her Erb's point is located at the left sternal border, third intercostal space, and that is where S1 and S2 are heard equally. Her tricuspid valve is located at the left sternal border, fifth intercostal space, and that is where, that's the tricuspid valve. And the mitral valve is located at the midclavicular line, fifth intercostal space, and that is where you can hear the apical pulse, as well as it's located at the midclavicular line and fifth intercostal space, and you can hear S1 louder at the apex. So I heard her heart sounds, the rate and the rhythm were regular, they were equal, the pulse was equal, and I did not hear any abnormal sounds. Now I'm going to inspect and palpate the abdomen. So can you please lie down for me? I'm just gonna lift up your shirt, is that okay? Mm-hmm. Okay, and I'm going to drape you. So I'm just going to inspect the abdomen. I don't see any pulsations, no lumps, bumps, lesions, or bruising. I don't see any lacerations. Hair distribution seems even. Shape is flat. Everything seems good on that part. I'm going to auscultate the 4 quadrants. So I'm gonna listen first to the right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. So her bowel sounds were present. I heard gurgling, so that is good. Now I'm going to palpate each quadrant for any pain or tenderness. Do you feel any? And I don't feel any superficial masses, no lumps or bumps. Any pain or tenderness? Okay. Any pain or tenderness in the left upper and then left lower quadrant? No. So no masses, no pain or tenderness. And now I'm going to inspect your upper extremities. But before that, I'm going to palpate for the bladder. So the bladder is midline. Everything is good. Okay, so now I'm going to inspect the upper extremities. So there seems to be no lumps, bumps, lesions, or bruises, no deformities or masses. There's no discoloration. Hair distribution is even. And they are symmetrical. And now I'm going to feel for texture. Texture is smooth. Turgor is good, non-tenting. Moisture is normal. Do you feel any pain or tenderness as I palpate? No. Okay, and I'm going to palpate the radial pulses. All right. So the radial pulses were of equal grade strength, 2+. They were symmetrical bilaterally. The rate and rhythm was regular and equal. And now I'm going to look at the capillary refill in her nails. So capillary refill is less than 2 seconds, which is good. Now I'm going to test for range of motion in her fingers. So can you please extend your fingers? Now flex them. Same thing with your wrist. Extension and then hyperextension. Same thing with your elbows. flexion, extension, supination, pronation, external rotation behind your head, and internal rotation behind your back. Okay, great. And now I'm going to test your abduction. So can you raise your arms to the sky, and then adduction towards your sides. Okay, good. And now I'm going to look at your lower extremities. So for your lower extremities, I see that the color is appropriate. The hair distribution is even. There are no lumps, bumps, lesions, or bruises. Everything seems fine. I'm going to palpate. Do you feel any pain or tenderness?
No.
Okay. Temperature is warm. Texture is smooth. Turgor is good. Non-tenting. Okay, and then now I'm going to palpate the dorsalis pedis pulses. So our pulses were of equal strength, 2 plus. The rate and rhythm was equal and regular, and I'm going to do the tibialis posterior pulse as well. Posterior tibialis pulse. So same thing, equal strength, rate and rhythm was regular, and they were equal bilaterally. And I'm going to test your abduction and adduction of your legs. So if you can just raise your legs, yep, and then adduct, same thing, adduct, and then can you sit down, flexion of your legs, just lift them up, extension, and then can you demonstrate dorsiflexion by pushing against my force, and then plantarflexion by pushing against my force. Okay, great. So range of motion was good. Did you feel any pain or tenderness while you were doing that?
No.
Okay, there are no signs of crepitus, and range of motion seemed good and active in all her extremities. So that would be the end of the head to toe assessment. Thank you.